A 2-week moratorium is underway on immigration from Indonesia due to the rising number of COVID-19 cases emerging among the migrant worker community.
That pause on immigration is hitting employers who are waiting for Indonesian care workers to enter the country, highlighting the fragility of Taiwan's health system in a globalized economy.
More than 10 years ago, Mr. Lu suffered a spinal injury in a workplace accident which left him paralyzed from the neck down. Now 53, his round-the-clock care is too much for his elderly mother. He relies on support from his Indonesian carer.
For example, when I get into or out of bed, I have to rely on her help. Washing, turning over, I always need her. So I need her practically 24 hours a day. My mother's very old and I can't put it all on her. She has to turn me over in the night too, about twice an hour.
A migrant care worker asks only 700 NT a day. A Taiwanese care worker asks 2,500 NT. And 76% of migrant carers are from Indonesia. With all immigration from Indonesia on pause for 2 weeks, over 3,000 Taiwanese employers will be affected. But employers say they are also concerned about COVID-19.
My friend is also applying for an Indonesian carer. If one came, I also wouldn't dare to meet her. You never know if they'll turn out to have the virus. There are so many Indonesian people testing positive every day. It's really very worrying.
Most Indonesians who come to Taiwan are migrant workers. This doctor thinks Taiwan should learn from the cautionary example of Singapore.
The biggest threat the pandemic poses Taiwan is currently via migrant workers. Although there's a 2-week pause now, we can predict that afterward it's very likely the border will be reopened to them.
When the pandemic first reached Singapore, it was quickly brought under control. But in April, daily case numbers grew into the hundreds, and 90% of those patients were migrant workers. Taiwan's long-standing reliance on migrant workers for healthcare is meeting unprecedented challenge in the age of COVID.